Alright, so today we are going over cardiac, peripheral vascular, and abdominal assessments. So we're going to start with the cardiac. So we're going to start by identifying the sternal landmarks. So we'll start with the suprasternal notch, which is right in the middle. So it's outlined by the sternocleidomastoids and the edge of the sternum. From there, we're going to follow down to the angle of Louis, which is at about the second intercostal. It's right up there. It's kind of like a divot. And that should be right about at the second intercostal space, which is there. So those line up pretty well. So we're going to, again, inspect. So I will have you lay down now.
Okay.
We're going to be flipping a lot.
Oh, okay.
So have you lay down with your head at about 30 to 45 preferably, but we'll make it work.
No idea what that means. Is that too much?
That's fine.
Is that too much?
That's fine.
Okay.
And then we're just going to watch the jugulars and make sure that there's no pulsation or no extreme pulsations in the jugulars. We're going to watch that. There are no pulsations, which is good, because that can be indicative of fluid overload, which we don't want either. And then we'll do the hepatojugular. So for that, we will push on the abdomen, watch the jugulars fill, release, and it should watch the jugulars contract again. So we're gonna push right about the liver, watch the jugular start pulsing, you release, and watch it stop.
Did it work?
It's real fun. Yeah.
You have to try these things on you.
That's fine. So that is a normal result on that. So then on the left side, we're going to watch for the apical. So stop shaking your leg.
Sorry.
We're going to watch for pulsing around the apex of the heart, because we shouldn't see that unless it's a super, super tiny person.
You mean not fat?
I'm just like, no, like really, really small people.
Oh, okay.
So we shouldn't see those, because if we do see that, if we see a jump or twitch, it means the heart is overworking.
Oh.
We also don't want that. So there's none of that. So then we are going to move on. We are going to use our bell of our stethoscope to listen for the heart sounds. So we will listen to the carotids, and then we will just listen to the typical heart sounds using the diaphragms. So we're going to go on with those. This one, which is second intercostal left border. So the heart sounds we listen for when we're doing that, we check for S1, which is the tricuspid. So we listen to that on the second intercostal space on the right side. And then we move on to the aortic, which is S2, which is the second intercostal on the left. We go down to Erb's point, which is the third intercostal on the left side. And then the tricuspid is where you hear S1, which is, the fourth intercostal. Aortic pulmonic is the second intercostal space. Aortic is the second on the right. And then mitral is S2, and that is the 5th intercostal. So those are the points that you listen to. So while we're listening, we note the rates and the rhythms. We make sure that S1, which is the tricuspid at the 4th intercostal, when we hear that, we want to make sure we see the carotid pulses to make sure those are in sync. And then the mitral at the 5th is the S2, which is where your diastolic and your blood pressure comes from. So you can make sure those all kind of match up while you're listening. So in that, we're going to listen to the carotids for Brudi's, which are very, very harsh sounds, which I did not hear with her, which is a good thing because we don't want those. They're blockages or bad things. Don't want those. So that's what we're listening to while we're listening to the heart sounds. Also going to listen for murmurs and any abnormalities. So now we'll move on to peripheral vascular. So we're going to just check in general for color, any kind of ulcerations or anything on her skin in the limbs and the extremities. So color's good. We're not blue, not gray. Blue is bad for people. There's no scars, no swelling, and no edema, anything like that. We check the temperature, make sure all the temperatures, she's not cold. You're not cold. We'll check that. Turgor, so we'll check the skin, make sure it's able to bounce back. Flip your arm over. When contracted, it bounces back, so there's no signs of dehydration in that, which I'd be really concerned if you were dehydrated, drink like a camel. So all of that is good. No tenderness when you press on anything. And then we'll also check capillary refills. So for capillaries, we take the bed of the nails, and you press, and then let go, and it should turn white, or it should turn back to color, which yours are already white. But you should get color refill.
Well, sometimes they are white.
Like this one will do it. You get color somewhat. I might do that too. I don't know why. But so what color was there when we started comes back. So there's that. So then we will check all of our pulses. So we're going to start. We're going to check temporals. We check them together. So it's right on the side of your head. And then we'll check carotids, which are one at a time, because we don't cut off blood flow to your noggin. Okay. 0, 2.
Oh.
We're going to check brachials. Okay. Hard because you're angle. We'll move to radials next. And we're just checking to make sure that we can feel them all and that they're pretty equal, they're pulsing at the same time. Those are good. And then we will move on to the femorals, which are going to be right here. And they're a little harder to feel as well. And then we move on to the popliteal, which is under the knees. Bend your legs forward so we can kind of see you a little bit. So those are kind of midline under the knee. They're very challenging to find. Our dogs struggle with.
Oh, yeah.
So we'll fill those. And then we will move on to the pedis, which I need your feet. Get your socks off too. So pedis is going to be between the first and second toes, right at the top of the arch. And then we also check the posterior tibial, which is at the base of the ulna, right at the large bone on the ankle. So that's where that is. So we just feel all those, make sure they're equal, make sure they pulse at the exact same time. So then we move on to the Allen's test, which we do before any radial procedures. So like if we do radial blood gases, if we do radial art lines, we check that. So we take this just to make sure the ulnar artery is good. So we block off the radial and the ulnar artery. Your hand should start to kind of go white and kind of feel numb.
There, yep.
So then we let go of the ulnar. You should start to get feeling back and get color.
It's warmth for sure, yeah.
Yep. And it's starting to turn back white. It's not white anymore. So that means that the ulnar artery is patent and it's good, so we'd be okay to access the radial, because if something went wrong with the radial when we did it and your ulnar wasn't there, you lose your hand.
Oh,
So that's what we do for those. So that is our peripheral vascular. So we will move on to the abdominal now. So for that, we check the contour of your abdomen, make sure there's no, that's an acceptable shape though. We want to make sure that there's no bulges, no unevenness. So like one side's not taller than the other, there's no like masses.
Yep, even bulges.
So like we're gonna check symmetry, check the belly button. I'm gonna kind of, you okay with me? Yeah. Make sure there's no discharge or anything crazy out of your belly button. Make sure there's no pulsation, so we don't see like there's no random thumping in your belly, so you don't know aortic anything there. Have you coughed? We'll check for hernias, because when you cough they bulge up. So have you coughed for me? Okay. And then around your belly button again for there's no crazy venous patterns, there's no pulling. You see it usually when people are pregnant. It can cause little veiny striations. So then we are going to check for bowel sounds. So for that, we check out, we're going to listen for frequency. We're going to start in the right lower and follow the track of the large intestine. Cool. We're going to listen. Lower. So you have gurgles. So, and in order to pay that someone has completely absent bowel sounds, it's 5 minutes listening in each section with no sounds. You have regular bowels. Oh, hi. Excuse me, go back. Can I see you? Right. Let me see you, buddy. Sorry. You stay there. So, and then we'll check the vascular sounds while we're there. So we're going to listen listen for Brutus or any kind of abnormal noises. We're going to listen to the aortic, the renal, the iliac, and the femorals. So, listen to the aortic in the midline. Please sit.
With those claws.
The iliac or renal here.
Exactly, it's not too loud.
And then we listen to the femorals. Again, just checking for abnormalities while we're listening to those. And then we're going to do percussion. We're going to do just general percussion in the abdominal area. So we're just gonna listen. We'll hit all the quadrants. Listen, make sure everything is dull. There should be no really, really sharp noises. Okay. So we'll check for the liver span. So we'll start here and we listen until the sound changes. Okay. And then come up, sorry. And it should have a pretty broad span. You listen for the change from dullness to a tympanic. So it should kind of change in pitch. It's a little louder when you have organs. Or changes to dullness with the liver. So that's the liver. The spleen is in the left upper. You should not be able to feel the spleen, and there should be no dullness with the spleen because it's under the ribcage, so that means that it would be enlarged if you can hear it, which is also bad. So there's no real loud noises there, so your spleen should be normal. And then we'll move on to palpations. We will lightly do, which is going to be about 1 centimeter. Just feel for tenderness, masses. Let me know if anything bothers you, if it hurts. I'm just going to hit all the quadrants. No pain, no tenderness. Okay. So then after that we go to deep palpation, which we typically do with 2 hands. It's 5 to 8 centimeters. That's, again, just feeling for masses, tenderness. So then look for abdominal muscle separation. So diastasis recti, which often does happen after pregnancies. The muscles right in the middle can split. So what I'll have you do is,
I got this one.
you have this
I
one?
think so, yeah.
So we'll have you do like a crunch for me?
Yep.
Yep. Oh. So that you can
Yeah.
feel the soft spot in the muscles. Again, common after pregnancies. And they just kind of want to keep an eye on it, make sure it doesn't do anything crazy. So we'll do that. So we will feel the liver, which you can kind of hook under on the right side, and you can kind of feel the edge of the liver. And you can kind of hook on the right and or the left here and feel the spleen somewhat. And then we'll check the kidneys. You want to come under your arm here, kind of on the side. You kind of hook under the back, and you can squeeze through, feel the kidney that way. And we'll reach over and we'll do that on both sides. Just to make sure they're not enlarged, they're not tender. So we'll do those. And then we will check the inguinal nodes. So like we did the lymph nodes earlier, there's 2 sets in your groin, so they run
The cat?
to the cat. They run this way. No tenderness, no heat. Excuse me, listen. You're obscuring my professor's view.
Have to go.
And then we'll check the other side as well. No tenderness. So they run kind of along the pelvis. There's a set that runs vertical and a set that runs horizontal. Horizontal and vertical. They can run by directions. So then we're going to check for tenderness in the kidneys with the costovertebral angle. Check for tenderness. So what I'm going to do is have you sit up for me real quick. Excuse us, kids.
Go over there, buddy.
So we're going to right at the kidneys. We're going to place our palms on the kidney. And then we kind of just strike. And that doesn't hurt, doesn't bother you. So that checks for polycystic kidney disease. Because if you had polycystics, that would be excruciating.
Oh.
Because the kidneys are swollen and inflamed, so that jostling on the kidney causes severe pain. So it kind of just lets us know how you're doing there. Lay back down for me. We're going to do some rebound procedure. So we're going to press on the left. We're going to check your appendix. So you press on the left and release. Doesn't hurt.
No. I'm sorry. The appendix is over here.
Yes.
That would make that hurt?
Yes. So if you press and release,
No.
nothing? Okay. So that's good. And then we will check. So that's the rebound. That was checking for Bloomberg sign, which is again the appendix. So then we do the inspiratory test on the gallbladder. So I'd press here, which you don't have one, right?
A what?
Gallbladder?
Yeah, I have a gallbladder. I
Okay.
have all my parts and pieces.
Okay. So have you take a deep breath for me? Okay. So that is Murphy's sign, which does the gallbladder. So while pushing, if it's a gallbladder thing, while we push on that, if you breathe in, we have what's called inspiratory arrest. You physically can't finish the breath because it hurts. So that's that one. So that should be everything. Alright. Sorry about the cat.